I'm going to recognize myself for 5 minutes initially, and I wanted to start out by asking Ms. Rowland. Some have advocated making Medicaid look more like private insurance, scaling back benefits and raising cost sharing on beneficiaries. Others believe in only providing a capped amount of money to a disabled individual and letting them contract for their own personal care services as maybe a better path. My concern is what happens when states give people vouchers and send them off for managed care plans. I know that Kaiser has done some work on the Florida experience where unfortunately people with disabilities had difficulty in the counties where services for people with disabilities were so-called reformed. So would you just, tell us about these models, whether they fit the needs of the vulnerable beneficiary, and then tell us about the Florida experience. I'm not necessarily trying to put a bad light on it, but I want you to talk about these options.
Well, we've clearly seen that the role Medicaid plays for people with disabilities is very different than what's available through employer-based private health insurance or unavailable really through the individual insurance market where pre-existing conditions and the cost of coverage would keep people from coverage. So that Medicaid really does provide for both medical care, which is what traditional health insurance does, and for all the kinds of transportation and long-term care supports that are necessary. So when we look at people who have private health insurance coverage and have disabilities compared to those on Medicaid, we see that those on Medicaid are far more likely to have serious conditions, and those with disabilities covered by private insurance are less disabled and more able to function without additional supports. What we have been evaluating and looking at in Florida is in the new capitation demonstration where in 2 counties now extended to 5, individuals are given a choice of health insurance managed care plans to participate in. Many of the people with disabilities have been included in this program, and they tell us that they were very confused, one about whether they were even enrolled in the program. They were asked to make a choice of plans, and the forms they were using looked very similar to the forms people got on Medicare Part D to choose for their prescription drug coverage. So there was a lot of confusion about where to go. They got enrolled into plans, and when they went to their counselors, found out that their counselors were giving them some misinformation about whether they could change or get out. And I think it really does point out that while choice of plans may be ideal, information and good counseling on what's available through those plans is critical. Moreover, in Florida, those plans have the ability to adapt the benefit package to live within the capitation rate. So we are now going back to evaluate after a year whether the benefits promised to these individuals when they joined the plans were actually realized. And many of the people with disabilities have said that the range of services they need were not covered within those plans, and that some of the doctors that they were used to seeing, some were in the plans, some were out of the plans. And we know for people with ongoing chronic illnesses and severe disabilities, maintaining coordinated care from the range of providers they need is critical. So we really do think one should take great caution in changing some of the care arrangements, and we think case management and a broad range of community-based services is perhaps a better way to go than putting people into a capitated situation where the plan may not be able to meet their full needs.
I wanted to go to Ms. Fortin because, as you know, when we had our roundtable in New Jersey, you talked, and some of there talked about flexibility in the context of, independent living arrangements versus institutionalization, and that, if there's a certain amount of flexibility, then perhaps that allows states and programs to get away from institutionalization and more towards, independent living. But I wanted to, Mr. Gronfeld mentioned in his testimony the need for more flexibility in Medicaid waiver services. And I know when we had that roundtable, there was talk about that being a good thing. But other times that flexibility may come at the expense of beneficiary needs. In New Jersey we had this cash and counseling demonstration that was very successful in giving people a budget to manage their personal care services. But then, the question is that you know, is that good, or is that then a problem? Because if you have vouchers like they have in Florida, the flexibility may actually make it more difficult to get services. So I just want you to talk about that in the context, you know, the whole idea of flexibility versus caps and how that relates to, you know, trying to get people avoid institutionalization.
Well, I think that we have to balance the idea of the flexibility with the oversight. And, of course, we are very concerned about any system that's in place that has the capitation rates. Individuals with disabilities are just that. They're individuals, and their needs are very individualized, and we can't look at a program where it's the same for all. Our cash and counseling program in New Jersey is a very successful program. We feel that the individuals having the ability to direct and choose their services has allowed them to get the right services for the individual. We also feel that in many ways it can be a very cost-effective program as individuals are able to choose what meets their needs best. For some individuals with significant intellectual disabilities, we have some concerns about making sure that there is appropriate case management and oversight so that the individual is getting the best services that they can and the ones that properly meet their needs. So there's a need for a real balance in the program as well. But obviously, as advocates for people with disabilities, flexibility and that whole idea of self-directed services is extremely important to us.
Thank you.